Celina, thanks for joining us.
No problem. Excited to be here.
So tell us about what you're doing these days.
So I'm the CEO at WomenHeart, and it's the National Coalition for Women with Heart Disease based out of DC. But we cover all 50 states, and we are a group of women who are here to support other women who are going through their heart journeys.
And tell me a little bit about the pathway you took to get to that job.
Yeah, I mean, it was sort of long and circuitous. I have a background in public health and epidemiology, but also in public administration, and have worked in the academic setting. I have worked in the private sector in corporate responsibility roles, but also with the UN in HIV and AIDS programming and strategy. Most recently, I was running something called the Global Alliance for Chronic Diseases out of London, which is an alliance of research funders like the National Institutes of Health in the US to fund research on chronic illnesses like diabetes in the developing world. So this job was really sort of a coming home, a coming back to the US to focus specifically on the number one killer of women. It's also the first time I've worked in an organization that focuses exclusively on women's health. And it's been a real learning for me and a real eye-opener about essentially the injustices and the differences between outcomes for women with heart disease versus men.
Say more about that, because I am likely part of the problem or a recipient of bad information, because I wouldn't have thought that. Shocked and surprised me that this is the number one killer of women. Yes. I have always thought about heart disease as a more male-dominated issue.
You and everybody else. I mean, I often refer to the Hollywood depiction of heart attacks. When you think about that, it's usually a middle-aged white man clutching his chest. I mean, that is what we think of a heart attack. But women have heart attacks as well. Their symptoms look different. And the stereotype of it being a male disease is so pervasive that women are much more likely showing up to the ER. If a woman and a man show up to the ER, having a heart attack, women are much more likely to be dismissed and told that it is stress or anxiety and that they should just go home and rest. As opposed to if a man shows up to an ER and says, I'm having a heart attack, they will be run through the diagnostic gamut, and inevitably their diagnosis will happen faster than a woman's, because we all, including folks who work in the ER, we all have this bias or this stereotypical idea for who has heart attacks. But it is the number one killer. I would also say that I think the breast cancer community has been really successful in raising awareness about breast cancer. And I think because of the breast, it is easier to associate that with women. And therefore, I think those who would be surprised that heart disease is the number one killer of women, if you ask them what they think it is, I think a lot of them would say, I thought it was breast cancer, simply because the awareness about breast cancer is so high. And yet heart disease kills more women than all cancers combined. So it's just something that, we have to keep beating the drum on, because the awareness levels are sadly not as high as we'd like them to be.
Wow. Super important message. And you talked about unconscious bias, which, that's become more and more called out. And people have come to understand it more and more as the kind of ESG and DEI movements have gained steam. Talk a little bit about how that has, helped people understand your work, engage with your work, maybe, provided some headwinds or tailwinds to your work.
Absolutely. So, I think there have been, a number of tailwinds for us engaging much more directly in health inequities. And this is sort of how we frame our DEI work. Certainly the George Floyd killing really, it was for lots of organizations in the US, was really kind of pushed us and compelled us to, for example, put out a public statement about the inequities that exist broadly, but specifically in healthcare and more specifically in heart disease. And we, have gotten funding specifically to focus on injustices and inequities that exist for communities of color. Our work now, a big part of our work is looking at addressing these inequities. We know, for example, that Black women are much more likely to die of heart disease, much more likely to be misdiagnosed or delayed in diagnosis. When we talk about the Black maternal health crisis in this country, where Black women are dying in childbirth at disproportionate rates, the reason they're dying is because of heart disease, of undiagnosed hypertension. We are in many ways the breaking open of this conversation in society more broadly has enabled us and allowed us to confidently address these issues in a much more frank and honest way.
Yeah, it's interesting, the kind of crossroads between systemic racism and systemic misogyny or gender bias. You talked about Black women. I think that's true in the workplace. Beyond health, that's true in advancement and other dimensions as well. So switching gears a little bit, talk about how COVID affect your work, and your engagement with the corporate sector. We worked together at the Global Compact. Before, you worked at the Gap and Mattel. And so you have a background in corporate responsibility or ESG as well. So I'm curious your thoughts on, COVID and engagement with the private sector.
It won't be surprising to anyone to know that we engage quite significantly with the pharmaceutical sector. They certainly have been instrumental in helping WomenHeart evolve over time and expand in our ability to reach women and to reach more women each year. That being said, no organization wants to be dependent on a single industry. And so before COVID, the idea was that we really wanted to diversify our funding from other sources. But once COVID hit, we were thanking our lucky stars that we had such strong relationships with particular pharmaceutical companies, because they were one of the few industries, let's say, frankly, that did well during the pandemic. And because of that, we saw them really step up and enable us to deliver support much more effectively and without skipping a beat. Of course, we had to do things that all organizations had to do. We had to shut down all of our in-person activities. We had to create virtual support groups and stop visits in the hospitals. We had to tell our volunteer corps that they couldn't do community health fairs anymore. Instead, we encouraged them to participate in online panels and online conferences, etc. And so that switchover, we always knew that was part of our future. We didn't obviously anticipate it being so near in our future. And because we had to do it and everyone had to do it, it made the transition easier for a population that we were a little bit worried about in terms of their uptake of, the sort of the technology required to do this work. And so now, as things are, let's say, heading back to somewhat of a new normal, we are going back into in-person activities, but actually we're also retaining a lot of the virtual platform and the virtual events that we were holding, because at the same time, it enabled us to address another big issue, which is access. Not everyone could get in their car and leave home and leave kids unsupervised, et cetera, to attend our events. So now, while it's not the perfect solution, it is certainly an important alternative that we'll always have available for those who might have issues for transportation or other things, other barriers that might get in the way of them participating.
Yeah, I think that makes a lot of sense. I personally have benefited from telemedicine and will continue to use that to the extent to which I'm allowed, or it makes sense with my doctor. I'm sure, once a year you need to go in and see them, but doing it virtually, I think makes sense. I'm working on a thought leadership piece, a research piece with CECP and the Gates Foundation on pandemic preparedness. Yep. And the point you made on relationships being in place before an emergency, a pandemic, what have you, and being able to rely on those. I think that pre-investment really pays off during these emergencies. And it sounds like you benefited from those and from a sector that was able to thrive is probably not the right word, but.
Exactly right. I mean, what did we do when the pandemic hit and we were all forced to shut down? We went to our most trusted sources of support. And
for better or worse.
For better or worse. I mean, right? Like, and what we thought we were doing was sort of moving ahead and sort of moving, into other realms. But then when that door shut and we had to stop doing, we had to stop sort of reaching out, essentially, we had to step back and look back behind us and go, oh yeah, these guys have our backs and we need to continue to rely on them. Because at that point, you certainly weren't opening new doors. To introduce yourself as a new organization during the pandemic, to attempt to get new funding, it was essentially impossible. So having had those strong relationships beforehand really made the difference and got us through the tough years of the pandemic.
Yeah, it's interesting how we all kind of go back to our safe space personally and professionally. We go to where, things are safest. And if we bring that back to the earlier part of the conversation, it makes total sense why Black women and the Black community would have lower trust in medical interventions, because their safe space is understanding. And it sounds like there's good reason to believe that there is an unconscious or conscious bias in the system that doesn't yield better outcomes for them.
Yeah, and that's one of the things that I know often happens. And one of our Black champions, Black volunteers, has said this to me. She said, the day that I met my now regular cardiologist, she's an African American female cardiologist, I just felt completely seen and understood, and the level of trust and the fact that I was going to get quality care just shot up. And I'm not, that's not true for everybody, but I think having the familiarity and knowing that that person at least has somewhat of an understanding for where you come from and the life that you live and the community that you are a part of really adds a lot to the overall quality of care that you perceive you're getting.
I think that makes so much sense. And this issue of trust, that so many companies, the big four, are all over it. And you see books emerging on this issue and have for some time. But I think this is a real issue that society's got to get its arms around. And the Edelman Trust Barometer shows that, business now is the most trusted institution in society. And I would argue that's not because people trust business more. It's because they trust everything else less.
That's right.
And business has done a pretty good job of staying, above the fray of whatever echo chamber we all find ourselves in. And some have gone deep in. Patagonia, has staked out the left, and maybe Hobby Lobby or, some of the others have staked out the right. And I think, they have a right to do that and express their opinions. But most have kind of tried to stay reasonably neutral on a lot of this stuff. Super interesting. So what are you doing that excites you these days, personally, professionally?
Oh my goodness. Well, it is, we're coming into spring, and that means things are thawing out. And that means I'm going to get back on the river to do some paddleboarding, which I'm really excited about. My other really big love is climbing, but I haven't done that in a while. But I think my shoulder's getting better. So hopefully I'll get right back to that very soon. And I'm excited that I'm about to buy this house so I'm getting my hands dirty, and I'm going to watch, I'm sure, a ton of YouTube videos and become like you, Jeff, tinker around the house and, fix a few things.
I do enjoy to have a hammer in my hand. So, well, all the best with those new emerging adventures, and thanks for your time today.
Thank you so much. It was great fun.
We'll talk again soon.